Today in this video we are going to learn about the therapeutic incompatibility. Therapeutic incompatibility may be as a result of prescribing a certain drugs to a patient with the intention to produce a specific degree of pharmacological action. But the nature or the intensity of the action produced is different from that intended by the prescriber. So this occurs mainly due to various reasons like errors in the doses, wrong doses or doses from contraindicated drugs, or through the synergistic and antagonistic drugs, or by drug interactions. So by all these reasons there will be a chance of therapeutic incompatibility. So we will see clearly one by one here. First start with errors in the doses. So here many therapeutic incompatibilities results from errors in the writing or interpreting the prescription order here. The most serious type of dosage errors in the dispensing is overdose of the medication. It becomes the duty of the pharmacist to check the prescription before dispensing it. Pharmacist is often in a position to detect such errors and help to avoid such problems. So we will see various examples, like first start with one prescription here. In this it has an atropine sulfate, phenobarbital and aspirin prepared 10 capsules. So this is the prescription given to the pharmacist here. In this prescription, the quantity of the atropine sulfate in each capsule is more than its maximum recommended dose. Okay, so the prescription is referred back to the prescriber to correct the overdose of the atropine sulfate here. Like that, another prescription like codeine phosphate 0.5 grams prepared 10 powder. So direction, one powder to be taken at bedtime. Okay, so that is the direction. This is the prescription given. So in this prescription, this is an example of an overdose prescription. The intention of the physician may be prescribed 5 mg and it prescribed 500 mg in this prescription. So the prescription may be referred back to the prescriber. The next one is the wrong doses or dosage forms. So there are certain drugs which have quite similar names, and there is always a danger of dispensing the wrong drug here. For example, prednisone and prednisolone, digoxin and digitoxin. Sometimes many drugs are available in different dosage forms, and hence if the dosage form is not clearly mentioned on the prescription, it becomes necessary to seek clarification from the prescriber. Okay, and the next one is the contraindicated drugs. There are certain drugs which may be contraindicated in particular diseases or a particular patient who is allergic to it. For example, corticoids are contraindicated in a patient having an active peptic ulcers. Penicillins and sulfur drugs are contraindicated to the patients who are allergic to it. Like that, barbiturates and morphine should not be given to the asthmatic patients. So these are some contraindicated drugs. We need to avoid to administer the drugs to particular allergic ones. So we will see one example of the prescription here. In this it has a sulfadizine, sulfamerazine, ammonium chloride. Take 2 capsules after every 6 hours. Okay, that is the prescription given here. So here ammonium chloride is a urinary acidifier. It would cause deposition of the sulfonamides in a crystal form in the kidney. Okay, hence the prescription should be referred back to the prescriber here also. And the next one is the synergistic and antagonistic drugs. Many drugs exhibit synergism and antagonism when administered in combination form. When 2 drugs are prescribed together, they tend to increase the activity of each other. Okay, so here when 2 drugs are administered simultaneously, here the pharmacological action produced by the 2 drugs is above than the summation of the 2 drugs here. So that is called as synergism. So synergism is usually intentional because the prescriber has prescribed the drugs together in order to increase the activity of the drugs here. So for example, combination of the aspirin and paracetamol increases the analgesic activity. Similarly, a combination of the penicillin and streptomycin increases the antibacterial activity of the antibiotics here. There are certain drugs which when prescribed may lead to a disastrous consequences here. So the prescription should be referred back to the prescriber for necessary corrections. We will see one example here like amphetamine sulfate, ephedrine and syrup up to 100 ml. Make a mixture. So that is a prescription given here. In this prescription, there is a combination of two sympathomimetic drugs with an additive effect. So there is a need to reduce the dose of each drug here. So the prescription should be referred back to the prescriber. When two drugs having the opposite pharmacological actions are prescribed together is called antagonism effect. Okay. For this example is acetyl salicylic acid and probenecid. Acetyl salicylic acid and probenecid are used in the treatment of gout. However, the combination of these leads to the neutralization. So refer back the prescription to the prescriber for necessary correction here also. And the next type of incompatibility is through the drug interactions. So the effect of the one drug is altered by prior or simultaneous administration of the another drug. Drug interaction can usually be corrected by the proper adjustment of the doses if the suspected interaction is detected. Okay, we'll see one example like that. Acetophenetidine, acetyl salicylic acid, caffeine, send 10 capsules. That is a prescription here. Here the acetophenetidine and acetyl salicylic acids are analgesic drugs. So acetophenetidine depresses the CNS and this side effect is undesirable here. Caffeine is a CNS stimulant, we know that, to neutralize the side effect of the acetophenetidine. So the incompatibility is intentional. So dispense the prescription as such here. Okay. And the type of example is tetracycline hydrochloride 250 mg, send 10 capsules. Direction for use is take 1 capsule every 6 hours with a milk. Okay, that is the fault here. So here tetracycline is inactivated by the calcium which is present in the milk. So the tetracycline capsule should not be taken with the milk. In this prescription, the therapeutic incompatibility is unintentional one. So the prescription may be referred back to the physician to change the direction for use. Okay, so these are all the various therapeutic incompatibilities. Thank you for watching this video. Please subscribe to our channel for more videos.